Our next talk will be by Dr. Sathyan Parthasarathy. He is going to talk on standard automated perimeter and virtual perimeter. Where do they stand today?
Thank you. I'll just briefly give you an overview of the old ones and the new ones. Then just asking you to decide. So I'll just talk about the two old ones, that is the octopus and the Zeiss. What are the new things that is interesting in that? When you're looking at the octopus, you have these all the softwares. If you can just access it in your desktop, then you can see these things. This is called as the ONH projection analysis. It is the structural change what you see in the disk that can be seen in the octopus perimetry. And of course, we all see the posterior polar analysis. Similarly, we can see in the octopus perimetry also that is available as the macular map. Then you have the serial analysis. I'm not sure how good it is in the Humphreys, but the serial analysis in the octopus gives you an overview of whatever the fields has been done, what kind of fields has been done. Everything is in detail, so that we can just have a quick look at the serial analysis and you can come to some conclusion in that. And of course, it gives you a very detailed analysis of the progression, including the polar and the cluster analysis, which gives you a good clue of where exact locations of the progression is happening. Say, for example, in the central 10 degrees, either in the upper half or the lower half, then we can, take the treatment accordingly. And if you have just done a 30 degrees, or say, for example, you have done a G program, then you can just convert that to a 10-2 program within the same thing. You don't have to really do one more 10-2 program. And all the points are being taken. You can see here, this is the 10-2 and this is the 30-2. Same thing, you can just convert and then take a look at it. Then, of course, we all know that many of the glaucoma patients, they don't come for a checkup because they have a binocular summation. That's why they don't have much of a visual field effects. So if you can see that in the perimetry also, this is the summation. You can see how nicely this is the reason why the patient is probably not coming to us. But of course, they have their own many reasons. But the binocular summation gives us an understanding how the patient is seeing. Looking at the Humphrey Field Analyzer 3, so we know that the Humphrey has been there for many, many years since 1971. 2018, they have the upgrade on these parameters like a CETA faster, and 24-2 C program is the newer addition they have, and the mixed GPA, CETA GPA program gives a complete patient test history for the GPA reports. Then the data synchronization and the review software, they have the automated patient alignment. You can see here, this is a CETA program, faster program, which seems to be even more faster than what it used to be. It just does the test within the 2 minutes time, and it is considered to be the same as the other programs as well. The other thing which they have incorporated is the automated patient alignment program, which has already been there in the octopus for many years, but they have also incorporated so that the patient is getting misaligned and then it automatically gets aligned. So you can see here. So that is one of the improvements that they have done. And of course, you have the interactive guided progression analysis in the workplace. You can see that how nicely it has been given the GPA progression analysis. But all these things, if you can really access the software than just taking the printout, you will be able to understand this much better than just taking the printouts and seeing things. So this is the one which is available in the Humphrey. This is the synchronization and the integration. And of course, reviewing the reports in your desktop with other, like OCT also have done, everything can be integrated and you can see that. So coming to the other perimeters, like this is one which you can do it in your iPad. This is the Melbourne Rapid Field Analysis Automated Perimetry. It is something similar to, the reports are similar to our Humphreys. So it is a portable device which is done in the iPad. The clinical validation shows that it is comparable to the Humphrey Field Analyzer. They have the reliability indices, progression analysis after 5 tests. And it is user-friendly, multilingual, there's a screening support, everything is there. And this is how the test is, what the patient is seeing. Everywhere it goes, they have to just touch it. When they see the dots, that's how the test is being done. It's not that difficult for the patient because many of them are used to the iPads. And this is how the report appears to be. On your right hand side, you can see the reports, which is similar to the HFA reporting, but it is little different than HFA, but they say that it is similar to the diagnostic ability seems to be similar to the HFA. and it is also used in the neurological fields, macular diseases, and the diabetes also. It is very pretty useful. And looking at the AVA, that is Advanced Field Analyzer, developed by ELISA Technology. It is a head mount, especially when the COVID time. This was one of the popular devices that many of the patients could be, used and tested, and it is very comfortable to use it, because when you are wearing the mask, we know that there have been many papers have been published on wearing the mask and doing the test is not that good. So you can lie down, patient can be sitting in the OPD area, everything can be comfortably done. The patient can easily do the test because the both eyes are open in this. So what the patient sees, the four dots, they say it is more accurate. It is something similar to the HFA patterns and can be used. So the advantage they say is it is obviously it is much cheaper. The testing time is quicker and it is quite comparable with the Humphreys. And the similar strategies are also available: 24-2, 30-2, and 10-2. And this is another. This is the components of the AVA component. The other one, the last one, is something called as the Alpha technology. This is one of the Indian companies. These are the parts of the device. It is something same as, but it has been accessed in your mobile phone to start on the device. Same way, it is all virtual perimeters. I think LBP also has one virtual perimetry, and there's one more company from San Francisco. All of them have similar pattern. This is color coded actually. And there are many versions are available in this. The recent version is called as the Intelligent Vision Analyzer. So the advantage of the visual perimetry is the patients are more comfortable. I have done it for myself than doing it on the Octopus or the Humphreys. It is much more comfortable. Both eyes are open, but then it has its own limitations in comparison to our existing perimetry, which I've shown you some of the advantages of what our old perimetries are already currently doing it. Thank you.